Hello and welcome to this VetLit podcast. VetLit Minis are journal club podcasts on a range of topics, small animal focused, so you can keep up to date even if you just have a few minutes spare. Today we're going to be learning about lily ingestion in cats. We're all very conscious that lilies can induce AKI, but how common is acute kidney injury exactly? And to help us with that, we have Dr. Erica Reineke, Professor of Emergency and Critical Care at the University of Pennsylvania School of Veterinary Medicine. Thank you very much for joining us. Are you well?
I'm quite well, thanks. Thanks for having me.
No, not at all. And I suppose that in particular, the reason that Dr. Reineke is here is that she's the final author on a recent study entitled Prevalence of Acute Kidney Injury and Outcome in Cats Treated as Inpatients versus Outpatients Following Lily Exposure. And that was published in JAVMA just very recently. Now, it's not just about the frequency with which we're developing acute kidney injury. It's about management techniques, is what we're going to try and think about today. And maybe as an entry for you, Dr. Reineke, can I ask from what direction you entered the study? Was it from the perspective that documenting that quote unquote conservative or outpatient treatment of these cats would be of value? In the current setting of recognizing that fluid therapy in animals at risk of or even with AKI is actually perhaps not as intuitive as it sounds? Or did you actually expect to find that amongst cats conservatively or outpatient treated, you'd see that a bunch of them had poor outcomes? How did you go into it?
Yeah, so I think that the reason we decided to look at this is because we were treating some cats as outpatients
Mhm.
for various reasons, whether because, the owner had some financial limitations to hospitalization, or there might have been cat specific factors, like the cat was aggressive
Yeah.
and would be difficult to manage in the hospital, or various other reasons that they may or may not choose to admit to the hospital for what we would consider standard of care, which is putting them on IV fluids, and monitoring for acute kidney injury. So we were treating cats as outpatient, and honestly, our feeling clinically was that the cats were doing quite well.
Right.
And so in order to confirm what clinically we thought we were seeing is why we wanted to do the study, so that we would be better able to advise pet owners of, maybe what the prevalence of acute kidney injury would be if they elected to treat their pet outpatient. So it was, just get some more information so
Yeah.
that, we're just better doctors in making these recommendations to
Nice.
our pet owners.
So then, can I ask you to briefly summarize and say what you did manage to what data you did manage to capture in these cats?
Okay. So if you've read the study, you will see that preponderance of the cats in the study were inpatients, because that is, our kind of standard of care at our hospital.
Mhm.
So we did end up having 16 cats that were outpatient cats. And so we were powered to see about a 30% difference in acute kidney injury prevalence between the two groups. So our final study, what we found, our final study results is that the occurrence of acute kidney injury was actually very similar between the two groups. So there wasn't an increased incidence in the outpatients compared to the inpatient groups. But overall, the incidence was higher than previously reported in a study that actually we had previously done out of Penn Vet several years ago. Maybe it was like 10 years ago now,
Yeah, yeah.
where we looked at inpatient management. I think the AKI rate in that study was 9%.
Right.
That was prior to the establishment of the iris grading. So, it was really truly only azotemic cats that we caught in that initial study. So in our study, when we used the iris grading, there was a much higher, we had a number of, grade 1 AKIs, but we had a fair number of grade 2s as well in our study. Only
Yeah,
one grade 3, I believe, and no
yeah.
4 or 5 AKIs, which is honestly fabulous. But there was no difference between the two groups of cats, which I think is great to at least get that information out there. That
Yeah.
being said, there were two, the last thing I'll say is there were two non-survivors in the outpatient group. And those two outpatient non-survivors had grade 2 AKIs. And their clinical signs at the time were like vomiting and they weren't doing well. And unfortunately, the owner declined continued care and ultimately euthanized those cats. I guess it's unknown to us whether those cats would have survived had they transitioned to an inpatient protocol. My hope would be that yeah, they would, because we did have one outpatient cat that did do that, that transitioned to an inpatient protocol and then had resolution of their AKI.
Yeah.
So I think that is an interesting finding that is a good option if an owner chooses outpatient, that they could transition to more of an inpatient protocol and could do quite well. But overall, I think that the outcome was quite satisfactory in the outpatient groups, which I think is an important information. Although again, keep in mind the caveat being it was quite a small sample size of only, 16 cats.
Yeah,
So
yeah. Because
yeah,
I suppose, yeah, I found it quite reassuring, really. Because, yeah, as you say, we had 16 in the outpatient, but that means that there were nearly 100 in the inpatient, right? 96 maybe.
correct. Yeah.
Um, and I found it really reassuring to see that when it developed, most of these were grade 1, grade 2. And although you've got these 100 or so patients, 116 patients, 112, um, those two that you pick up on are quite interesting to think about, aren't they? So they had poor outcomes, they ultimately euthanized, but as bad as it was ever documented was a grade 2. That's pretty reassuring. And yeah, as you say, hopefully if it was converted to a more if they were converted to a more extensive management protocol, maybe they too would have had good outcomes. That would be really cool to know, wouldn't it?
It would have been. It's kind of a bummer that those two cats, we couldn't have, I don't know, figured out a way
Yeah.
to treat them to see how they did. But yeah, I think it is nice to know that they may have done okay. As far as I know, they weren't, anuric. But again, given the retrospective nature of the study, it's hard to say. But I do
Mhm.
think it is from a severity of AKI. If we just look at all of the cats together, there wasn't any cats requiring renal replacement therapy or became oligoanuric, which is also
Yeah.
interesting and could suggest that, the severity of renal injury maybe isn't, it's we don't want any of our cats to get an AKI, but maybe it's not as life-ending
Yeah.
as sometimes owners are led to believe, that if
Yeah.
their cat got into a lily, that's it, which is good to know. So I think the incidence of really severe kidney injury is low, is probably quite low,
Yeah. Yeah.
probably. Yeah.
So then, if we might open a huge can of worms here, but while you're on the call, it'd be really interesting just to get your opinion because I was having a little read around, the previous data on these kind of cats, and I suppose my question for you is how, if or and if so, how your or our approach to these cats has changed over time with regards to use of fluids. Do you think that's an emerging and evolving area? And if so, in what direction?
Yeah, I think this is probably a discussion that would last much longer than a
Yeah.
podcast about how we approach intoxications in general and our approach to fluid therapy in these cases. Well, first off, I'll say our study wasn't designed to really look at the effect of treatments per se because it was a non-controlled study. And so I guess we have to be cautious to say that the fluids were protective and in the inpatient groups, or
Mm.
subcu fluids were protective in the outpatient group. So I guess I can't really truly comment at the effect of IV fluids. But
Yeah.
in my practice, I think that one could make an argument that supporting renal perfusion and supporting urine production and potentially being able to remove any kind of debris from the tubules that could lead to obstruction, removing casts and that type of thing. If there is kidney injury, one could support that may be beneficial. But do I do diuretic rates of IV fluids? I do not.
Yeah.
Um, I think that kind of for using fluids for hemodynamic support is may have a role, may have a role. There's a caveat there
Yeah.
since, yeah, no one has looked at that, right? We were talking about this earlier. I guess really to know what the effect of IV fluids has on this toxicity or in the course of this toxicity on kidney injury, you'd have to randomize cats to no fluids or fluids and to know whether there is a protective effect. And I think that that study is unlikely to be done in a clinical setting and would be hard for me to do in a research setting because the control group might have a really high incidence of kidney injury, and that might be hard
Yeah.
for
Hard to
veterinarian
justify.
to justify. Yeah.
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 Yeah. But
What do
so
you do? I'm curious what you do. Is that
yeah.
fair? Am I allowed to ask you questions?
Yeah, of course. Yeah, yeah. That's quite fun actually. Yeah. Yeah, I mean, we are a whole lot less aggressive with fluid therapy in patients full stop, and especially in patients with what was previously assumed to be a risk of acute kidney injury. Because yeah, whilst we haven't got good data, building we are building a case over time, aren't we? That the positive fluid balance situations are really, as a minimum, they're a whole lot more deleterious than we ever used to recognize. And then, so yeah, so there were some recent guidelines come out last year about AKI in cats and toxicities, saying that, essentially beyond the maintenance of renal perfusion, there isn't such a strong case to be quote unquote forced diuresing. That's not really that's much less of a thing. I think that's as much as we can really say, isn't it? That's much less of a thing than it ever really used to be. And people are it's very possible to challenge the use of fluids in toxicities such as um, grapes and raisins and lilies because the deleterious consequences are much more recognized than they ever used to be.
I
Um,
100% agree. Yeah.
so yeah, we are when we're quite we might actually be quite far the other direction in that we very infrequently will hospitalize. For example, the raisins and the grapes. Those are outpatient cases for us now. The evidence maybe isn't there to say that we're correct in doing that yet, but definitely the mood is changing in that field. So yeah, we're a whole lot less aggressive in fluid therapy use in intoxications. The couple that we mentioned anyway. Yeah.
Agreed. That makes sense.
Well, I mean, it's been a real pleasure to have you on board. Thank you so much for joining us and imparting your wisdom. The aim of VetLit is to make veterinary literature both more accessible and accessed, and hopefully we've secured that in some small way today. Remember, you'll almost definitely find an article to read that interests you on the vetlit.org site. Check back here, there, or via the email updates for more. And otherwise, have a great day. And it's bye bye for now from both of us.
Bye.